Welcome to PD Exchange, the Peritoneal Dialysis podcast. As always, I am your host, Dr. Nikhil Shah, a nephrologist at the University of Alberta, Canada, with my co-host, Dr. Jeffrey Pearl, a nephrologist at the St. Michael's Hospital, University of Toronto. Dr. Pearl is also the editor-in-chief of Peritoneal Dialysis International, the official journal of the International Society for Peritoneal Dialysis. Today, we welcome two guests on our show. First, we have Karine Minera, who is an associate editor for PDI. She is a research fellow at the University of Sydney, Australia, and her work focuses on patient-centered care in peritoneal dialysis. She is a committee member for the Standardized Outcomes in Nephrology, or the SONG initiative. And we have Annette Spence, a patient partner who has experienced all modalities of dialysis and has recently received a kidney transplant. She has participated in the SONG initiative to provide the patient perspectives. Welcome all.
Thanks, Nikhil. And it's really great to be back to, I think this is our third podcast in the series, and I hope everybody's enjoying it, and we definitely would welcome feedback. Today, we're really excited to really showcase life participation in peritoneal dialysis based on some of the fantastic work by the SONG group, which is Standardizing Outcomes in Nephrology group. It's pretty hard to see any paper published in PD these days where the introduction doesn't talk about how SONG has placed the importance of peritonitis or time on PD therapy. And now we're moving on to talk about life participation. And in the 42, issue 6, November 22 article of PDI, issue of PDI rather, you can find establishing a core outcome measure for life participation in patients receiving PD, a standardizing outcomes in nephrology PD consensus workshop. So let's start things off with Karine. Karine, welcome. And just a question, maybe for those of people who aren't familiar with SONG, can you talk about what SONG is and what your involvement in SONG has been?
Yeah, sure. Thanks, Jeff. So SONG, the Standardized Outcomes in Nephrology, it's an international initiative where we aim to develop core outcome sets across the spectrum of chronic kidney disease. In my role, I coordinate the peritoneal dialysis stream. And to date, we have gone through the process of conducting focus groups with patients and family members, an international Delphi survey with a range of stakeholders, including patients, caregivers, clinicians, policymakers. And we come to the point where we conduct a consensus workshop and establish the core outcome measures. And so we've completed that now. And as you mentioned, life participation has come as the top patient-reported outcome. It's identified as a critically important outcome for all stakeholders, so for patients and their families and clinicians as well.
Okay, so a couple questions on that. How many songs have we been singing? You said that this is a sort of nephrology-wide initiative. Which arenas have had a SONG work group or SONG focus in nephrology?
Yeah, so there's a SONG core outcome set for hemodialysis, for transplantation, peritoneal dialysis, and in more recent years for chronic kidney disease broadly, children and adolescents, SONG kids, that is, and polycystic kidney disease.
That's amazing. So there's a lot of singing happening. And tell us, when you say core outcome and like you're working towards a core outcome, what is that actually like? What's a core outcome to somebody who may not be familiar with research or have a background in research? Like, what do we hope to do with these like core outcomes we're trying to develop?
Yeah, so we define core outcomes as an outcome that's critically important to all stakeholders involved. So an outcome that's important to patients, their families and clinicians, policymakers and practitioners. And the goal of this is to have an outcome that is consistently reported in all trials in this area. So we want every trial that's conducted in peritoneal dialysis to report as an outcome these ones that we've found to be critically important, including life participation.
Right. So if we're going to do in PD, and correct me if I'm wrong, the highest level of research are randomized control trials, which we know are very much lacking in PD and in dialysis in general, where we allocate by, randomly to one treatment group versus another, and we look to see how the treatment fares. What you're saying is if we're going to go to the time and the expense and the effort to do these trials, we should make sure that we're capturing outcomes of these studies that are really important to the whole PD community. Is that sort of the gist of what you would say the initiative for Song PD is about?
Yeah, that's exactly right. It will make all of our research, especially when we're investing so much time and money, to know that it's actually relevant and meaningful to everyone that's going to be impacted by this research.
Right. So we're talking about life participation today, and we're going to get into that in a. Tell me what the core outcomes are for PD that have been developed. And I assume life participation is one of them?
That's right, yeah. So we have life participation, mortality, infection, specifically peritonitis, cardiovascular disease, and technique survival.
So those are really important outcomes. Annette, what do you want to tell us a little bit about your journey with kidney disease, and maybe tell us how you feel about some of these core outcomes having been treated with PD before?
So my journey began with lupus. My kidneys were destroyed by lupus. So there was a bit of investigations going on prior to it being determined that I had lupus. And by the time they recognized the fact that I had lupus, it had already 80% destroyed my kidneys. So I was then given the option to either do hemodialysis or peritoneal dialysis. When I was told about the options between the two, I decided go with the peritoneal dialysis modality. I was on peritoneal dialysis for approximately 2.5 to 3 years. And unfortunately, I wasn't able to continue that treatment. So I had to switch over, if you call it that, to hemodialysis. I tried the home hemodialysis for a little bit over a year, I think. And then I had to do in-center dialysis because I started experiencing tendonitis.
And you participated in the song workshop when you were on PD.
Yes.
What was your experience participating in song as a patient partner?
I was first of all happy that the dialysis patients were involved in this workshop, and I had the opportunity to attend. And I learned a lot from different individuals, and with the various workshops that I attended, it was very informative, and realizing that I'm not, just one of few. So I enjoy that, and listening to the speeches at the workshop, what's involved in the future and what they're doing, not just here in, Toronto, but like it's a worldwide issue.
Great.
That's excellent. My next question is to Kareen. You identified the 5 core outcomes that the song work group came out with. One of the outcomes that we are going to talk about is life participation. And when I was talking with my fellows, that was something that they did not know more about. So can you explain it a little further on what life participation from a research perspective means?
Yeah, so life participation is defined as the ability to participate in activities that are meaningful and important to you. So it could vary from anything from, family duties, study, paid or voluntary work, recreational activities, anything that you might do in your daily life that is important to you.
And Annette, would you add something to that and how our fellows should approach that? When we have a patient on dialysis sitting in front of us, how do we talk about this?
When they're already on dialysis or
even before, or even before. It should be even before dialysis, obviously, yes.
Yeah, even before. So everything should be explained. One will not remember everything at the initial visits, but for life participation, as it's been described, being able to continue with your life before being treated for dialysis is very important, because one regret that I have is that I wasn't able to continue working. And that's a very, very, very important factor. And maybe because of my complications with lupus and all that, and with the investigative process before, that probably was not an option at that time. But it's nice to say continue with your life before dialysis, but it's not always like that because some things are lacking, like work, what you were able to do physically in the beginning is not that quite feasible anymore. So instead of being 100% what you were before, you're now about 60, 70%.
You raise a really important point. I didn't think about this before. Maybe I'll ask you, Corinne. Like when I think of my life participation, there's me, the father, and all my duties as a dad. There's me, the nephrologist, and all the things that I have to participate in at work. And then there's me, the person that hopefully likes to cook and bake and travel and participate in recreational activities. Do you see life participation as sort of a multi-domain type of measure that looks at various activities within our lives and the different roles we play? What are your thoughts about that, Corinne?
Yeah, absolutely. I mean, all of these things fit the definition of what's meaningful, what's important to you. So if you're able to do all of these things that, encompass your life and what's important in your life, then that's your life participation. If some of that's hindered for any reason, then your life participation is hindered for some reason. And I think Annette raised a really important point that is kind of reflected in the findings of the workshop, which we can get into. Annette, you kind of defined life participation as being able to continue your life before dialysis or before treatment, which is really important to consider because obviously your life changes hugely. One of the themes from the workshop discussion was about reconfiguring expectations of daily living. So acknowledging that your life does change, that your life participation is going to be redefined because you had to stop working. Other people have had to stop, doing other things because of how they feel or their treatment or their time burdens, things like that. So in our definition, it's not exactly being able to do what you did before dialysis. It's what's your life participation at the moment, whatever that be, whether you be on PD or, with your kidney transplant or having hemodialysis.
Do you think that people have different expectations and that factors into their perception of life participation? Do you think some people are happy with and have expectations that might be less? And so what's that interplay between what people can actually engage in and what they're satisfied with engaging in, if that makes sense?
I think, Annette, you might be good to answer this from your own experience and if you know other, people.
Yeah, like do you think that there's differences in what people expect that they can do? And do you think part of that is being satisfied with what you can do, even though it may be less than, let's say, another patient? You know what I'm saying?
Initially, it's like, well, I'm stuck. I can't do anything. Like, gonna be on dialysis or I'm on dialysis, can't do anything. You can't work, enjoyment with your partner, house cleaning. You think the worst initially for me. Once I've started treatment, I realized, yeah, I can still do a lot of things, but with limitation. Being told that, okay, peritoneal dialysis, number one, which was important, I can still travel, a little bit cumbersome. That was good. Work was out of it. There's a psychological thing to it when we're talking about, being able to do. I mean, for me, not a child or a retired person at the time, working was really important. But I didn't get to, for self-actualization, finish up my career after 25 years and then kicked out. I still have that behind me, what ifs. So the expectation was hopefully to end up going back to work after a period of time, but my situation must have been a little bit more complicated the way I was at the time.
And now that you've had a transplant, congratulations. Yes. We're so happy.
Yes.
Has your life participation changed? And in what way?
It's changed. I'm slowly getting back more energy. And there's a myth with this transplant thing. And when I say myth, I've heard from one or two individuals who have had transplant, or I've heard it somewhere at our little mini seminars that we had before. Oh, once you get a transplant, it's like night and day, you feel much different. Not in my case, right? Because for the first month or so, I was a little better, but then I started feeling lagging and lethargic and all that. But now, it's now about 10 weeks now, from September, mid-September to now, I'm feeling much better. But there is limitation for most of us because of COVID. So I can't, I'm not going back to work, right? Because I would have had 33 years service now by now or something like that. So work is out of it. For me now, it's just the regular everyday thing. So
Do you think you'll go back to work?
no, not there.
And you know, you
I'm
mentioned
retired
house
of
cleaning. I don't know if I'd be so excited to life participate in house cleaning.
No, but I can take over back my kitchen and do all
Right.
my stuff
I'm
because I
just
have the
joking.
energy now. I have the energy. I can travel if I want and do what I used to do. So everything right now with transplantation is back to normal.
That's great.
More or less. Yes.
Can I
back-
ask you, Annette, how long were you on PD for?
I think about 2.5 years for PD.
And did your
then-
ability to participate in life change during that time?
It had a psychological thing behind it for me because it's not regular your daily living. Because I have to think, okay, at 8 o'clock, I got to set up my machine, I got to do whatever. To the point where, you know, my husband and I, we share the same bedroom. After a while, he's in another bedroom, I'm in my bedroom because of the machine and the interruption, so to speak. So it changed that. And there were days, and then there's the expectation that everything has to be done as per trade because I did not want to get infected peritonitis. That's always in the back of my mind. And it changed because the way I used to operate, I have to operate differently because, you know, the material delivery, storing, all that. So that was cumbersome. I forgot I had the catheter. You gotta, you know, I was mindful of that all the time. And to the point, I didn't really want to approach my husband or he, you know, because of all that. You are not really yourself, especially where that is concerned. But that's just a part of it. And you had to, and what really even made me a little bit more depressed is when I was not the ultrafiltration process was not working as it should, which led me to do the hemodialysis. Because before I was just strictly nights for the 8 hours or whatever period of time for peritoneal dialysis. But then I got to the point where I had to be carrying during the day for about 4 or 6 hours. So that was not fun. So everything was centered around me doing the right thing for my dialysis. Everything else was secondary. And hopefully one day it does not have to be, other activities would not have to be secondary. Should work in tangent one-on-one, but everything was around the dialysis, especially peritoneal. In center was a bit different because I know, okay, I have these days to go, they'll do that for me. But at home, you know, I'm thinking, okay, I want to do it longer. I did mine every other day. I said, the more I do it, because your kidney works 24 hours a day. So I said, the more I did it, but then that became like a real task after a while. The positive was that at least I was in home.
It's a trade-off between not being able to do things when you're doing dialysis for the ability to do more when you're not. That's how I always view sometimes home dialysis.
And the other thing, this perspective from a patient on dialysis is an eye-opener for many people, right? It's not just, okay, I'm prescribing dialysis. My prescription has real consequences on their life participation. And I believe that is something that we all need to incorporate and inculcate.
Right. You know, that's a great point, Nikhil. That's a great point about like using this measure of life participation to help design optimal prescriptions for patients would be really a value add. I'm interested to hear more about how to measure it.
Yeah, so Kareen, this workshop brought out some themes. Can you kind of explain what the themes were and what they actually mean?
Yeah, sure. So we conduct this workshop to get different perspectives on how to develop and create a measure for life participation. I mean, we are called the standardized outcomes in nephrology, and even, a concept as, some may consider a bit intangible as life participation, it ideally will develop a standardized measure that can be used across all people receiving PD. So I mentioned before, one of the themes that came out of it was about reconfiguring your expectations of daily living. And this was reflecting on a few things that patients said about how their life participation kind of changed depending on the day. Some days they felt great, some days they felt terrible. And so the amount that they could do changed. And so when you're thinking of developing a measure, you kind of present the measure and it will ask you, thinking back over the past week or thinking back over the past month. And so there was discussion about what should that time period be? How long in the past should we ask people? So like, for example, Annette, if, someone was asking you, yesterday, how did you feel versus, over the past week or over the past month, would your answer change in terms of how much you're able to do?
Yes, it will. Some days, yeah, your body does not remain constant. And some days you're not feeling up to it, you're not feeling well, for example. So it's never the same. It was never the same for me. Some days I was more energetic. Other days, more down. And with the downness comes mental stuff. And that's one thing also I would recommend initially when I was doing my dialysis, whether it be peritoneal. There's much more support. I had much more support for peritoneal dialysis as opposed to hemodialysis. One key area, I think, and especially more and more these days, they're talking about mental health. Or not that I had mental, but sometimes you're down because you'll be here, everyone else is gone, your friends, your family, they're out working and you're stuck here because you cannot do whatever. So sometimes it has a depressive part to it.
I think one of the other themes that we've already kind of discussed here is it's named shifting thresholds of acceptability. And so here we're talking about, what do I define as acceptable life participation? So for Annette, it sounded like when you're on PD, your life kind of paused. It was completely focused around your treatment, your hygiene to prevent any infections from the treatment and all of that. So we're talking about, if we're asking you about your life participation, do we compare it to, your lifestyle now or before? And yeah, so one of the quotes that was included said, even though you may not be able to do everything like you used to, it doesn't mean you're not enjoying life. So when you were talking in it, I was thinking, for some people, it seems like, especially if you're just on PD for a short amount of time, your life might be kind of paused. And you're kind of just dealing with that pause with the hope or expectation, maybe you're expecting a transplant soon, so you're only on PD for a few months or something like that. That would be different. I guess what they consider acceptable life participation would be different to someone that's on PD long term, 5 years plus. They might have just adapted, and for them, they might find ways to fit their life around their treatment in such a way that, like I've heard people say, it becomes just like brushing your teeth. And so for them, they might think that, life participation, it's changed, but it's, I guess, acceptable or it's adapted to their new life.
It's really interesting, Kareen. I never thought about that. Like the mindset you have about the therapy. Like if you're thinking about it as a bridge to a transplant, you may pause your life. If this is your therapy and the transplant may not be an option, you've got to cope by saying, how am I going to maximize life participation? So that's a really, really great point. I want to ask you something else that I struggle with, and maybe some others do. In a previous issue of PDI, we published a randomized control trial of PD versus hemo in China. And in that study, the China Q, they looked at burden of kidney disease and quality of life measures. And Many of us are used to some studies that have reported indexes of quality of life, the KDQOL measure, the other ones. Tell me what you think, how does life participation differ in your mind from a quality of life measure? I know they're both under the umbrella term of patient-reported outcome measures, but tell me what you think that the nuanced difference is.
I will, but first I'm going to quickly ask you and Nikhil, how would you define quality of life? So Jeff?
Oh, I got the question thrown back at me.
Oh boy, putting us on the spot, eh?
Yeah. Yeah, I mean, to me, I feel that it's the ability to continue to enjoy all aspects of life and continue to live a life that is fulfilling, pain-free, comfortable, and one in which I feel physically and emotionally well.
Yeah. And how about you, Nikhil?
I always, when I'm discussing this issue with my patients, I'm talking about the classic quote, right? You don't live for dialysis. Dialysis helps you live the way you want to. And that is the quality that I'm looking for.
Yeah. As we define it, life participation kind of fits under the broader umbrella of quality of life. So quality of life is a broader concept, and it can be hard to define, but if you do look at kind of questionnaires for quality of life, they incorporate life participation and ability to do activities, but then they also incorporate things like pain, as you mentioned, Jeff, things like symptom burden, function, so as well as, psychological and mental health, all the different aspects of life. Life participation, however, is specifically about ability to do those activities. It doesn't include concepts like symptom burden, for example, but it fits within the broader umbrella of quality of life.
That's really great. That makes a lot of sense to me. And do we have a questionnaire? Like, can we go now and ask about life participation at all of our clinics? Does one exist, or this is to develop that?
So we've developed one for transplantation. So the SONG team is currently working on validating measure for life participation in people with kidney transplants. In peritoneal dialysis, no, is the simple answer. We don't. I conducted a systematic review looking at all the different kind of questionnaires and measures that they used for life participation, and it's really varied, and there's a lot of issues with them. So a lot of the time, quality of life questionnaires are used to look at life participation. And the issue with peritoneal dialysis research is that there isn't a whole bunch of research into it. So a lot of the measures that we use, they haven't been validated in patients with PD. So they might be validated in people that have been receiving a transplant or hemodialysis or with chronic kidney disease in general, but there's never been any work to kind of consult patients and say, hey, do these questions that we're going to ask you, do they match what's happening in your life at the moment? Are they appropriate for you?
Right. And is the transplant questionnaire like a good place to start? Like to say, okay, how can we make this work for PD?
Yeah, I think so. So. Yeah.
And then my last question to you, which I struggle with, is it's kind of like Goldilocks and the Three Bears. How do we make a questionnaire that's not, I mean, the longer you give it, the more you find out, of course, but the more patients get fatigued. Like, Annette doesn't want to sit there and answer a 45-page questionnaire every 2 months, that's going to be onerous. On the other hand, if you make it too short, you don't get the nuances of what we need to know. What are your thoughts as a researcher in this area and an expert in terms of how do we balance like fatigue versus making it a meaningful questionnaire to ask what we wanted to?
Yeah, you're right. I mean, it has to be long enough to capture all the different concepts that we want to capture, but not too long to prevent people from wanting to do it. It's tough. I mean, first step is looking at what's already out there, and we've done that, and there's existing measures. There's one called Promise, and they have a 4-item question, and from that was the basis of developing the life participation question for transplant. And so, having a starting point is a good place, and then from there, talking with patients, doing content validity, asking them, are these questions appropriate, and then doing, psychometric validation. Yeah.
That sounds really, really important.
My last question, and this is a topic which is a bit difficult. Many of our dialysis patients and CKD patients have underlying, maybe sometimes undiagnosed depression. That mental state can affect your life participation in so many ways. How do you account for that as a researcher? And Annette, after that, can you speak more about it if you can? So, Kareem, maybe you go first and say, how do you account for that?
I mean, yeah, that's a really important question. I mean, first of all, I'd hope that in all clinics there is appropriate screening tools for depression in patients, and so that they're getting the appropriate help. When we're developing, a measure for life participation, I can imagine with a completed measure, if they're scoring such that you can see that all aspects of their life are impacted, they're not participating in life. And if you're doing this, I mean, we developed the measures with the goal to conduct them in clinical trials, but the way that I see this question is also using it in clinical practice, in which case, there's a big role there for clinicians to pick up any issues, to screen for them. This tool isn't, it's not developed as a screening tool for depression or for poor mental health. It's going to be to measure life participation.
But Karine, I think it goes back to your initial point, which is that the overall term is quality of life. If we look at these components, physical functioning, emotional well-being, we think about depression, we think about anxiety, all of these affect each other. They're all going to interrelate to each other. And life participation is like one circle in this whole web of overlapping circles. So each measure assesses one thing properly, but of course, if we see someone who's poorly physically functioning, that might affect depression. That might affect life participation. So it's all about, I think, we're trying to understand one domain really well. But of course, when someone has poor life participation, it's going to be linked to so many other domains. And I guess clinically, it's our job as kidney care professionals to work with our patients to try and tease that out as best we can. They're just screening tools, but we got to get into we've got to really then take an in-depth understanding and use that to say, okay, so, Annette, I'm just using you as an example. Your life participation has really changed. Let's get into it and figure out exactly why that is. Maybe we saddled you with more dialysis. Maybe you're feeling depressed. Maybe you've gotten the tendinitis and that's really caused you to be physically poorly functioning. So I don't know, Karine, if that makes sense, but I'm kind of figuring it is all overlapping with each other.
I might just quickly add, before you pop in, Annette, that in the consensus workshop we did identifying life participation as a core outcome, there was so much overlap with fatigue. It actually wasn't depression that was the focus, it was fatigue, and people talking about how I want to participate in life, but I just don't have the energy. I just can't. My fatigue is too strong that I'm limited. So
and hemodialysis went to fatigue group, right? Like hemo went to fatigue group. Which is interesting because it's just, it makes sense how that could be impacted. Annette, do you sort of agree with that? Like these overlapping circles of different...
It all overlaps. Anxiety, okay, I have to go dialysis or I have to do my dialysis. Depression, but I mean, I think personally I've experienced that and unknowns to the people around me, like my husband or my friend. So patient knew that they have, when you're feeling down or anxious or down, is there someone I can call who will listen to me and give me some results as to what to do or what to think about, not to think about? Because that played a role with me. At first, for the first few years, it was okay. I was coping, doing what I had to do. But as time dragged on, I started to become depressed. Not throughout, but there are times I would sit down and just be depressed, right? Thinking about this thing. When and am I going to be like this for the rest of my life? I can't plan to do anything as such because these 3 days out of the week or these every other day, it's hard to plan. As you say, dialysis, you have to plan around it. Yes, but then plan around it, everything else becomes secondary. And one still expects to function to a greater degree as before, as pre-dialysis. But then, see, when everything is revolves around your dialysis, then sometimes you say, why bother, right?
I think this is there are so many layers to this life participation, and there is so much to learn. We are almost out of time, so I'm going to say thank you so much for these fabulous insights and a peek in your lives, and it especially, and from a research perspective, Kareen, thank you so much for
Yeah.
participating
Yeah.
in.
And I just want to say, yeah, I also want to say thanks. And Annette, it's really great that patients such as yourselves volunteer your time to participate in these activities and to share your voice, where so many people may have similar feelings and thoughts, but may not necessarily have a forum to express them. So thanks so much for joining us. And Kareen, to people like you who do this amazing research on in PD and are hopefully filling the gap between some of the paucity of PD research and really, I think, developing a really robust science around a better understanding of the patient experience of dialysis is really, really remarkable to see. Putting a plug-in for PDI, Karina is an associate editor for PDI on the patient-reported outcome metrics, and you'll notice a lot of the issues of PDI come out with the patient editorial that Kareen has worked so hard to help curate. And again, thanks for all that really hard work on PDI. It does not go unnoticed. And on behalf of everybody, Kareen, thank you so much for those contributions.
Thanks, Jeff. Thanks, Nikhil. And lovely to speak to you, Annette.
Thanks.
Thank you so much. And that's a wrap for today's episode. Many thanks to Kareen and Annette for being on the show and sharing your thoughts on life participation. Link for the paper is in the episode details. Please reach out to us on social media for comments and suggestions. Our Twitter handles are in the episode details as well. Hope you enjoyed the show. This is Jeff and Nikhil signing off. Until the next PD Exchange. Take care.